So our coalition, for those of you who are less familiar with it, we started in advance of the G7 in Canada in 2018, and we were blessed to have a very strong advisory committee, which is comprised of organizations such as Jack.org, the University of Toronto, iFred, and Batyr. We are now over 100 organizations strong, with representation from countries around the globe, including Argentina, Australia, Canada, Colombia, France, Japan, Nigeria, India, the Philippines, Singapore, Slovakia, South Africa, Sweden, the US, and the UK. And our aim in 2018 was to inspire the G7 government to essentially incorporate youth mental health in its communique. And we were very focused on that effort, and we're pleased that they did in fact include youth mental health and its importance in their communique. And this was a long road of, as I'm sure many of you can imagine, many letter writing campaigns. Many of you, as part of our coalition, brought letters to government leaders. We held hangouts online with youth delegates participating in the Y7. We did a variety of tactics and had a regular drumbeat for the year to really drive this message home. And we were so thrilled and touched by the success of that effort, which was really made possible by our fearless advisory committee leadership and our coalition members. So in 2019, our focus is to continue that advocacy work. We want to drive global momentum and continue to highlight the key issues for global action. We certainly want to touch on topics ranging from stigma to access to parity research. We also are very focused on promoting our members and increasing connectivity among them. So this year we are going to be hosting virtual forums. We want to place our coalition members at venues across the globe and arm them with the materials and information that they need. And then we certainly want to continue to build capacity for our members. We know that so many of you have different expertise and different topics that are near and dear to you, and we want to bring that information to our coalition members through training, through education, through best practices. It's actually a wonderful example, I think, is our first webinar of the year, where we have the opportunity to feature someone who probably needs no introduction, Dr. Saxena from Harvard School of Public Health, who's also worked, as many of you know, for 20 years with the World Health Organization, and really is just a leader in youth mental health, youth mental health, and we're so delighted to have him with us today. We also have a member highlight, which is going to be a feature of each of these webinars, where we will highlight one of our members and their program that they offer for youth mental health. So stay tuned for our next speaker as well, Kathryn Goetzke with iFred. But for now, I'd love to turn it over to Dr. Saxena to walk through the slides and the latest information that you have been just moving with as the editor of the Lancet series. And we're just so thrilled to have you, and can't wait to hear the latest information that you have to share with our members today. So welcome, and I'll turn it over to you.
Thank you very much, Brooks, for inviting me. Can you hear me?
We can hear you perfectly.
Thank you so much. It's such a pleasure to join this forum, and I am happy to share some of the information that the editors and authors of the Lancet Commission on Global Mental Health and Sustainable Development wrote over 3 years' time, and this commission was launched in October 2018, and I'll focus on those issues that are relevant for mental health of youth. I will give some information about why youth mental health should be a focus for the community's attention. What could be done about it, and how youth could themselves take a very strong partnership in making that happen. So I am advance the slide. Yes, so that's the summary of my presentation. This is, as you can see on the screen now, this is the cover page of the Lancet Commission. It is available on the Lancet website with the registration, but with no payment. So it is in public domain. And the theme is about our minds, our future, our humanity. The whole agenda became much larger with the 2015 Sustainable Development Agenda of the United Nations, which for the first time included promotion of mental health and well-being as a very essential goal for sustainable development. This is the first time the presidents and the prime ministers of all countries in this world included mental health and well-being as a part of prevention and treatment of substance abuse, which obviously is also a very important issue for youth, as well as universal health coverage. And health here must mean health in all its dimensions, which includes, as per the definition of health by WHO, including mental and social well-being. So this is where we began in the Lancet Commission. Just to give you a few figures, mental, neurological, and substance use disorders are extremely common amongst communities and countries. And here on this slide, you see the large numbers of prevalent cases. And these are figures for adults, but they're equally common during childhood and adolescence. And we're talking about tens of millions of people who have some of these disorders which are more severe, and hundreds of millions who have a common mental disorder like depression and anxiety. But also note that these figures have been increasing, and there is between 10 to 30% increase over the last 10 years' time in these figures. Part of this increase obviously is because of the increase in population, but there is also a larger increase amongst youth, which is obviously a matter for great concern. There is a metric that is applied on the burden of disease to compare different causes for the burden. Like, for example, infectious diseases like HIV and malaria and tuberculosis cause a certain amount of burden. And by this metric, we can compare the burden because of mental and substance use disorders versus other disorders. And as you can see on this slide, there has been an increase over this burden for mental and substance use disorders over the last 25 years. And this increase is for all regions of the world. So it will be not right for us to assume that these are problems of the high income countries. They are there for the increase is about 50% over the last 25 years. And these disorders now account for 1 in every 10 years of lost health globally. These are figures that are really, really disturbing for an increase, absolute increase, as well as a relative increase in the numbers of the burden and the numbers of the people who suffer from it. This slide actually explains the burden across the lifespan. And as you can see, the blue lines which are peaking, it's like a mountain between the ages of 14 and 35. And this is the distribution amongst ages. So we can see from this slide that the mental and substance use disorders start during the youth time. As many as 50% of them starting a bit before the age of 14, and as many as 75% before the age of 35. So we are talking about a very large increase in the prevalence and burden amongst youth. And this is the age when people should be studying, people should be joining work stream, people should be contributing socially and economically to the welfare and the productivity of the society. And this is the age where some of these things are beginning. There is obviously also an increase during the middle and older ages, and these are more because of neurological disorders. There is a lot of science now accumulating on the theories of our understanding of mental health. And here we see the phenomenon of plasticity in the brain, which is very high during the early ages of life and continues to decrease over the period, over the lifespan. So the plasticity is very high during the youth time. And also there is another phenomenon in the brain, which is called pruning and differential maturation, which comes up between the ages of 10 and 25. And these two phenomena are very much associated with why and how mental disorders could actually be beginning around this age. There is also the third phenomenon, which is senescence, which is somewhat degenerative changes in the brain, which is very small during the early ages, but obviously it advances as the age increases. It's like degeneration of many of our other body organs, but brain degenerates starting from middle ages to older ages. And what is quite interesting is that these are the two critical periods, the youth, where the plasticity and pruning is taking place, and then also the senescence, where more neurological disorders appear. And the incidence of mental and substance use disorder follows exactly the same pattern, very high during the youth time, and again another peak during the older ages. So this explains the interaction between the brain maturation and some of the brain functioning, and the environmental factors, which are also playing a large role in that. And this kind of convergent understanding of mental health helps us to explain why some disorders start early and others start late. But it also gives us some ideas about how some of these disorders could be prevented and also treated over these critical periods of time. Another insight which the Lancet Commission gives is about the dimensional approach to mental health. The world cannot be divided into two groups of people, some who have mental disorders and others who don't. In fact, mental health is an attribute for all of us, and we all are on this dimension. Some of us might have very good mental health, some of us may not have that good. And this slide explains that there is positive mental health on one side and psychosocial disability on the other. And we are somewhere on this spectrum during different phases of life. But also what could be done about it? For all of us, for you and I, we could promote our mental health depending on wherever we might be on this dimension. Some of us might be more prone for mental distress and mental disorder, and we can do something about to prevent them. And if we have a disorder, to take care of that. And if we have a stable or chronic psychosocial disability, we could strive towards a recovery. And this dimensional approach to mental health is best suited for taking the preventive and promotive actions, besides, of course, treatment that may be necessary for some people. Another very important aspect is to pay attention to human rights. We believed that a right-based approach is the best one for mental health. The people's rights need to be protected. There is a right to receive care, which it should be respected by all governments. And there is the right to dignity and freedom, because for many people, this right is actually abused and not honored within mental hospitals as well as in the community. There are a large number of social determinants of mental health. For example, a large number of women and girls are the victims of violence. There are a very large number of people who are affected by fragility, conflict, violence, and wars. There are a large number of people, including young people, who are living with HIV and AIDS or other chronic diseases. And there is the phenomenon of urbanization, where informal settlements, which don't even have the basic necessities of life, are imposed on increasingly large number of people. And these are all risk factors for our mental health. These need to be prevented, but if cannot be, then resilience and support need to be provided for people who are undergoing these risk factors. Brooks have already talked about the loss of time and the loss of money because of mental disorders, and the figures are extremely high. The economic burden of mental health condition is not in millions of dollars, not in billions of dollars, it's in trillions of dollars over a period of time. And these are losses which are happening now, which are going to increase, and we need to see to it that these losses can be decreased. And in fact, by suitable policies and practices, these monies could actually be recuperated so that there is a net return on the investment which societies and countries do on their mental disorders. But the facts are, and the reality is very different from what should be done. Even for common mental disorders like anxiety, depression, and substance use disorders, the numbers of people who receive help in terms of minimally effective treatment is actually very small. For low and middle income countries, the numbers are less than 10% actually. And even in high income countries, it's less than a quarter of people who receive any care which is minimally effective for example, for depression, anxiety, and substance use problem. We should all be ashamed about the high treatment gap that is there for some of these disorders, which are very common and very burdensome. The Lancet Commission made 7 recommendations, and I'll focus my attention on just a few. But just to enumerate, we talked about reframing mental health as a global public good. And I talked about the dimensional approach to mental health, which is an integral part of that. We also suggested that mental health care should be one of the basic pillars of universal health coverage. There should be no health care without mental health care. We need to use public policies to protect mental health, and we gave some examples about how that could be done. We need to listen to and engage people with lived experience of mental disorders, including and especially youth, to contribute towards policies and practices which will be best suited for them. We need to invest far, far more on mental health, and this investment should be in terms of human resources as well as financial resources. And this gap of what is needed and what is there in all countries, high income as well as low and middle income countries. We need to use research to guide innovations and implementation, and we need to strengthen monitoring and accountability. Essentially, protecting mental health with actions on social determinants like fighting poverty and inequality, educating everyone, enhancing equity, advocating for gender equality, as well as opposing violence and discrimination are things that each government can do. We also need to strengthen public engagement by implementing evidence-based interventions to reduce stigma and discrimination, and to engage civil society, especially young people. We also need to, as I said earlier, make better investments. We need to increase the amount of health budget which goes into mental health to at least 5% for low and middle income countries and at least 10% for high income countries. We also need to innovate in methods for enhancing mental health care, especially amongst youth, involving young people in planning mental health services, use of technology for self and peer help, which is a very important part of the innovative techniques which could be used, especially for young people. We need to strengthen school and college mental health programs. We need to remove systematically barriers which prevent young people from accessing care. And we need to pay special attention to minority groups, including those who are somewhat different from other people, including LGBT and victims of violence. These are things that can be done now. These are things which need to be done now, and they need to be done on a global basis. Thank you very much, Brooks.
Wonderful. Wow. Thank you so much, Dr. Saxena. I'm really, as much as I was familiar with some of the data you shared, I'm really struck by the low numbers of treatment and data associated with the social determinants of health. I just want to take a few minutes and invite our listeners to participate in some Q&A, and before we move to Kathryn, and folks do have a chat box at the bottom of your screen, so you're welcome to send a question to me, and I can pose it for Dr. Saxena. I'd love for you to talk a little bit more about prevention, and do you have any thoughts or insights around what prevention interventions have the highest chances of success, given where we are and given the low rates of treatment and access to services? I'd love to hear you speak a bit about prevention.
Thank you very much, Brooks. Yes, there are things that can be done on the prevention side. One of the main things is skills training for resilience and taking care of stress. In fact, even monitoring our own level of stress is something that all of us can do. There are many technical solutions available to how to check our own stress level, and also safeguarding and seeing to it that we get enough sleep, we get enough nutrition, and we are prepared for the day-to-day stresses is something that all of us can do. But in addition, some of us at some points of time are more prone for stress. For example, educational stress, exams, a new job, a financial loss, a problem in relationship. And we need to develop our own skills, which vary from person to person, about how to take care of these stresses. That is something that each one of us can do. But at a policy level, taking care of people who are vulnerable, for example, as I mentioned, conflicts and wars, migrants, and other minority groups, is something that needs to be done at a policy level. And prevention is obviously much better than waiting till the time some of the mental and behavioral disorders appear, and to take care of that. I'd just like to mention also that self-harm and suicide are increasingly a problem for in many countries amongst all age groups, but especially amongst youth. In fact, young people die less often, but if they do die, one of the prominent reasons is suicide. And this is the second most common reason for suicides amongst youth, of death amongst youth. And there a lot can be done. Timely help by family, by community, and if necessary by professionals can. So that's another area where a lot more needs to be done.
Right, absolutely. Actually, we're getting a bunch of questions on the chat. If you will indulge us, we'd love to share. One person's asking your thoughts on peer support and how it can be implemented to help young people.
That's something that needs to be focused very much, because we know that all over the world, and especially in low and middle income countries, the numbers of professionals who have been trained to look after mental health problems is very small. In fact, there are countries which have a population of 19 million and just 7 psychiatrists and 2 psychologists. So there is no way professionals can look after all the needs of the people, including of young people. And neither is there a need for all problems to be solved by them. In fact, lesser trained professionals as well as peers can do a lot. Some amount of training is very useful for providing peer support, and tools like the psychological first aid, mental health first aid, and some other very light programs can actually be helping peers to provide the kind of support that they need. And in fact, peer support prevents stigma to be increased in the community, because if you can take help from somebody who is near you and you don't need to be identified as a person having a mental health problem, that probably works much better than going to a professional. Obviously, some people will need professional help, and peers can actually identify those people who really requires a more higher level of professional help. So I would very strongly argue for all of us to be trained in providing kind of peer support for people who are under crisis or about to develop mental health distress and problems.
Yeah, no, fantastic. Couldn't agree more, and really appreciate that level of detail. I have one more question coming in, and actually a few more. So I'm going to ask you this one now, and then we will turn to Kathryn, and I hope you'll stay on till the end so we can do some final Q&A. But one question came through from one of our coalition members asking if you could give an example or perhaps elaborate on your final recommendation around strengthening monitoring and accountability with services. If you could just expand upon that a little bit. Oh, are you there? Dr. Saxena? Uh-oh, did we lose him? Dr. Saxena, can you hear me? Okay, it looks like we may have lost him temporarily, which I hope he'll be able to hop back on, but I think—
Brooks, I just managed to unmute myself.
Okay.
So I'll just take a minute on the last question, which is again very interesting.
Yeah, thank you so much. Great.
For each level, whether it's a community, a province or a state or national level or international level, we need to measure what we are doing and what is the impact of any interventions on the overall mental health of communities. And organizations like WHO, as well as some other organizations, have a number of indicators that can be used to measure the state of mental health within the community and countries. And those are very essential methods to track over a period of time, as well as across countries and regions, as to how mental health is doing. Just like we measure physical health of people, we also need to measure mental health and mental well-being of people. And unless we measure it, we won't be able to change it.
Great, absolutely. Thank you so much. And I don't know if you answered, are you able to stay on? And so we could do a little bit more Q&A with the group at the end of the hour?
Yes, I'll be happy to be there.
Okay, great. Well, thank you so much. So I'm going to turn it over to Kathryn Goetzke with iFred, who, as I mentioned, Kathryn is a member of our advisory committee for the Global Coalition on Youth Mental Health, and really was instrumental in helping us very quickly come into formation and grow our advocacy work. She is an entrepreneur, a philanthropist, a strategic consultant, and really one of the most inspiring advocates out there for youth mental health. And as we continue to build out our virtual forums to benefit our growing membership across the globe, we are going to be featuring a member in each of those webinars to basically bring a curriculum, a best practice, a case study to all of you. Knowing that, you know, our role is really to amplify, to shine the light on the good work that's happening. And so we want your feedback on this approach. And we certainly couldn't be more excited to kick it off with our expert today, Dr. Saxena, and our member highlight and fierce advocate, Kathryn Goetzke. So with that, I'm going to turn it over to you, Kathryn, and we look forward to hearing all about hope.
Thank you so much, Brooks. I so appreciate it, and to your team for putting this together, and Dr. Saxena. Always love hearing you speak. You're such an icon in the space, and you've done so much to move mental health forward globally. So it's a great honor to be speaking with you. And I'm really excited to be here. I've been a part of this Youth Mental Health Coalition. I guess it's been about 1.5 years, and it's been such an exciting experience, and seeing the movement and momentum in youth mental health is really what keeps me motivated in the space and engaged and inspired, because youth are definitely our future. So really great to be here. Just a little background on myself. I started the nonprofit about 15 years ago, perhaps. I run a company as well and was looking to do a cause marketing campaign for mental health at the time, and noticed that a lot of the imagery and language around mental health was focused on the symptoms, and was surprised to learn that most mental health conditions are very treatable. And again, to learn about the large treatment gap that Dr. Saxena had spoke to earlier. People just aren't getting treatment. And if it were cancer and we had solutions for cancer, but people just weren't willing to get treatment or didn't want to, there would be a global outcry. So I felt that same internal kind of need and desire to make change in the space. And my background, again, is marketing and business, so I really came at it more from a marketing and branding standpoint, looking at what other disease states had done to change stigma and how could we take that and apply it to mental health. So did the first nationwide cause marketing campaign for mental health through my company, and that really enabled us to create Hopeful Minds. And cause marketing, just a little background, that's when like breast cancer did it very effectively. So they put pink ribbons on the packaging of products and raised money in retail locations on the consumer shelf to help support research around the disease. So I did that same thing for mental health with my company. And that allowed us to create this program called Hope and Hopeful Minds. And we created it about 5 years ago. And I am super excited to be here and to share more. So let me see how I. All right. Okay. So the first thing I did was look at, we have a global advisory board, probably the best experts in the world. Not the best, but some really amazing experts. I just want to mention my colleagues, Dr. Myron Belfer and Christy Stark, who have helped a lot with the program, and also Dr. Karen Kirby and Ulster University, who's helping with a lot of the research around it. So what we did is we looked at the primary symptom of depression, anxiety. Saw an underlying theme, and that's hopelessness. Hopelessness is the leading predictor of suicide. It's the second leading cause of death for youth, but it's now the leading cause of death for teen girls ages 15 to 19, I believe. There was a study published that 1 out of 9 students are self-reporting suicide attempts before graduating high school, with 40% of them in grade school, which is quite shocking. It's the primary symptom of depression and anxiety. So there was a recent self-reported study in the US that 36% of adolescent girls are depressed before graduating high school. There was one that 25% of girls in the UK before the age of 14. And then there was something just published that 70% of US teens ages 13 to 17 said that anxiety and depression is the most critical issue facing themselves and their peers. So we have a big challenge ahead of us. And again, especially with youth, hopelessness is also associated with delinquent behavior. It's associated with weapon carrying in school, all forms of self-directed violence, and also interpersonal and partner violence. Hopelessness is associated, or it's higher among the LGBT community, which is something I just came across at a staggering 63%, versus heterosexual students, which 27.5% is still high. And it's higher among those that experience childhood abuse. It's higher among victims of bullying and also the bullied victims, who are both bullies and being victimized by bullying at the same time. And it's often a consequence of race-related discrimination. So started looking at this, and when we think about prevention, we wanted to look at, okay, what is the biggest symptom, and then how do we come and combat that? So, you know, hopelessness is also, it's been defined as negative expectations towards oneself in the future. That's kind of the definition of hopelessness. And the symptoms are both motivational, so you feel helpless, and they're emotional, so you feel sad. And again, so we took a look at what is the opposite of that, and it's hope. And then how can we strengthen that? So hope is a universal concept globally. It's one that is easily understood in most cultures, and we found that as we've done the program and programming. And the challenge to date and previously had been, how do you operationalize the concept of hope, and moving beyond just kind of seen as a fluffy kind of concept, but really or optimism, but really as a structured program that you can actually teach and instill in youth. So that's what we're trying to address with the challenge. And so hope is really kind of having, there are a number of definitions and theories around hope, but in simplistic terms, it's having an expectation that is both desired and possible. So I can want something, and then I can figure out a way to kind of do it. So, and it's also, the literature supports that it's likely that resilience is an outcome of having hope, which is interesting because a lot of programs in prevention focus on resilience, and yet the research says that unless you can't have resilience unless you first have hope. So the really great news about it, and that we started learning when we were developing, when we were studying initially, is that research suggests that hope is a teachable skill. So it's a skill that you can teach. The best way and the best thing to do is teach it before the age of 10, because it really integrates into the child's kind of learning. But you can teach hope at any age. For myself, I practice it all daily. It's just harder to learn as you get older. And then we see higher hope. It corresponds to greater emotional and psychological well-being, actually better physical health, less violence, which is really interesting, improved academic performance, so better grades if you have higher hope, higher quality leadership. There was just a study I read on that people, one of the top 3 leadership traits they look for is hope, and for leaders to create a hopeful working environment. Less stress, less loneliness, better social connection, less anxiety, less depression, enhanced personal relationships, and less likelihood to die by suicide. So there's a great, I think, opportunity for us to really start to try to understand hope and again, operationalize it and teach it globally. So we developed Hopeful Minds, and just a little background. So the Hopeful Minds is comprised of 12 core lessons, and it's all on our website, and it teaches students the social and emotional learning tools to develop and maintain hope throughout life's challenges. You know, and again, this is what we've learned to date, and we're constantly improving and iterating on the program itself, and learning as we go. But basically, we took everything we knew and we structured lessons around it. So it was developed based on leading research on hope. So these are hope researchers, Dr. Guy Winch, Dr. Shane Lopez, Dr. Anthony Scully, Sierra Snyder, and others. And then we also use the social and emotional learning standards that were implemented around the nation in the US through CASEL. And we have a world-class advisory board. So in each of the lessons, we have objectives, critical thinking questions, discussion points, hands-on activities, and stories to enhance student comprehension. We also have supplemental projects, critical resources on depression, and parent and teacher resources available. So as we said, a lot of mental health issues start showing up at a young age, and if we can, through our program, also start educating on what these are, and giving parents handouts on them and teachers handouts on them, it also helps from a prevention standpoint in getting these kids into treatment if they need it. You know, this program is not at all meant to treat anxiety or depression. It's a whole school approach to teaching the concept of hope and the skills that we all need to build and maintain a hopeful state. So some different things we do in the program, we have kids define hope, both an individual definition and then a classroom definition. we'll look at what supports a hopeful state, the emotional self-regulation techniques, dip into mindfulness, goals and pathways, obstacles, look at brain nutrition, success is the journey and not the destination, passion and purpose, about what that is, giving hope. We look at failure as an indication not of a failure in a process, and help kids not internalize that. And that's really important, especially as it relates to grades, because when kids fail in classes, they often think that they themselves are a failure, and we help them kind of reposition that as something along the way to getting your grade failed. And let's look at that process and how can we change that? Do you need to study with friends? Do you need to prepare earlier for the exam? We talk about rumination and how to end rumination, creating a network for hope. We know connection is very important, and so we make sure kids identify people they can talk to, especially when they're not feeling hope and they're feeling hopeless, so they always have at least one person to turn to. And then planting and receiving hope, they write messages to hope to the next incoming students. They do some planting of sunflowers, and then harvesting of sunflowers and the seeds, and then they replant them the next year, so kind of the cycle of hope. That's basically the program. It's free. It's available globally. Let's see here. Okay. So, and we created the program with these things in mind, which I think is really important for anyone, working on a program. From my business experience and just being in the space, I saw many programs kind of come and go because they weren't sustainable. They required a lot of resources to go in and teach people, and a lot of materials and handouts, and that was frustrating for me to witness. And so we were very conscious of how we actually created the program itself, so that even if we run out of funding for it, people still have access to all the materials and can teach it in their communities. So it's scalable. It's free, so it's a low cost to entry. You can go online and you can download the materials, and really you should be able to read through them and teach them in your community. It's adaptable for age ranges and cultures and economic background. We did it in Malaysia, and there wasn't a necessity to change anything, which was wonderful. Kind of how we test that is we print out the materials and hand them out to groups, and have the groups teach back to us to understand if they've really comprehended it without us teaching them. So you can change the stories, but really the concepts around it are the same. It's very prevention focused. We know the return on investment for prevention is much greater, and it makes human and financial sense. And, the World Health Organization a few years ago launched a report that for every $1 invested, you get $4 back for interventions in mental health. And, what might that look for in preventions if we could prevent this, anxiety and depression, even suicide from happening in the first place, which is my ultimate vision and dream. And it can also be used universally. So we don't need to single anyone out. We don't need to look at kids and decide, are they anxious, or hope is a skill that we all need, and we all need to build and strengthen. So yeah, we've been featured around the world. The Innovation recognized it as an innovation. Spoken at the Kennedy Forum, Mental Health America, and it's been really, really exciting. As I had mentioned, the University of Ulster in Northern Ireland has been doing a lot of the research around it, so we're really excited and grateful for all of their support. They did research around the outcomes for primary school children. There wasn't a control group in it, but we know in general in the population in Northern Ireland, anxiety and depression in youth are growing. So when they looked at the kids that went through the program, they saw hopelessness reduce significantly with the hopelessness scale for children. They did a how I feel questionnaire. They saw emotional regulation improve significantly. And they used the Spence generalized anxiety measure, and they found anxiety reduced significantly in kids. So this is really exciting for us, and why we're really passionate about expanding the program. We also just launched a Hope Badge so that really anyone can get a sense and a taste of the program. we go through the training, we have a quizzes, and this is through 7 Cups, which is a peer-to-peer support app, which is incredible. And again, so important if, there's such a large treatment gap. We know one of the things that works in mental health is having at least one person you can talk to, and 7 Cups allows for that. So it's an app you can download and connect to someone else that might have anxiety or depression or an eating disorder within your specific age range. They have helped 25 million people in 189 countries, they use 140 languages. So we just launched a Hope training badge with them, which is on their website, and the link is on this page, but you can get, it's for any age, it's any age above 13. You can start to kind of work on your own Hope skills that way. And then we also, again, this program is free and it's available to all. And our goal is to teach as many people about hope as possible in schools and healthcare systems, after school programs, community gathering. So yeah, we just encourage you to become aware of hope and would love and appreciate if you can bring it at all to your community as well. So I think that's it. Once you choose hope, anything is possible. It's very true.
Thank you so much, Kathryn. That was super informative and also really inspiring as always. And, I'm just curious if you could expand a little bit upon, folks, feel free to send us questions via the chat for both our speakers, and I'm happy to answer a few more before we wrap things up. But I'm curious, can you expand upon the age range? I know ideally I think you said before 10, but can you expand a little bit, just to knowing that a lot of people listening to this webinar, either live or recorded, are serving different segments of the youth population, and any guidance around that, or is it truly adaptable whether you're very, very young or in your college years?
Yeah, absolutely. And great question. Yeah, it's so our Hope, the Hope badge training on 7 Cups is for we kind of modified it. So it's for 13 and above. So really any age over 13. I see the Hope curriculum is really below the age of 13. We focused on a really specific age range so we could do some research around whether or not this was even working. And we're finding some good results on it, and so because it's such a critical age for kids as they move into years where anxiety and depression really start showing up, if we can give them some tools that help in protection against that, that's why we focused on that age range of the increase in around 11 and up in suicide attempts. And so if we can give them some tools for emotional regulation and failure and rumination to kind of prepare them for that. But again, yeah, it's great for all age ranges, and we really hope to take what we're learning with the young kids and then apply them to all ages and settings. I mean, workplace, how do you create a hopeful environment in the workplace and leaders, and in healthcare systems and with other disease states, and how do you kind of maintain that hopeful mindset throughout the process of what you're dealing with. I also think the interesting thing with teens that we've seen is that they don't necessarily like to be taught things, because they do know a lot. So
they know it all. No.
I was a teen. Yeah. So what we're trying with that group is we're giving them the lessons, and then we're just having them teach each other and figure out ways to teach each other kind of the concepts and how they would do that. But the underlying principles and kind of philosophies are the same. It's just kind of how you engage with others. And at some point we'd like the old population to teach the young kids about hope. I mean, there's so many different ways that it can be done. I think the implementation is really interesting and fun. We had and really supportive of both the person teaching it and the person experiencing it. The BBC just did a documentary on our program in Northern Ireland, and a woman that had actually lost her daughter had died by suicide the previous year. She was in the classroom actually teaching kids the next year of the Hope program, and she talked about how much it had helped her, as well as the kids, which was, very touching. I personally lost my own father he died by suicide when I was 19, and I can't imagine, I mean, it definitely inspired a lot of this, and I can't imagine having taught it at that age, and yet this has been so healing for my own journey as well.
Wow, that's really beautiful. Thank you for sharing that. We did have a question that came through on the chat. You might be able to see, Kathryn, but you alluded to the generalizability of your findings in different settings, like low income settings and globally. Any more detail around that and what you're finding so far?
Yeah, so we're just doing a study. We got a little bit of money or Ulster did from Global Grand Challenges. So we're doing a little study in Malaysia, but honestly, we're looking for help around implementation and funding of those studies. The research I find is the most expensive thing in the space. And in validating it. So, I mean, we would love partners, anyone listening that has any connections to help us do that and accomplish that. We've pretty much, and Ulster University has been incredible. They've done this all just supporting the program itself and been able to fund it on their own. So the research and are in the process of publishing a number of papers about it. So we haven't really, I mean, people are using it and we don't have studies around that. And again, would love support in doing that.
Great. Well, great. Well, that's fantastic. And thank you. And we'll make sure, as I said at the top of the hour, we will be sharing this recording with our global coalition membership. We'll be sharing it on social. So this is why we're doing this. We want to feature the latest information. We want to feature the best practices and our members that are doing great work, so you all can be collaborating and doing things together. So just in terms of wrapping, so I just want to thank you both. We're so grateful to Dr. Saxena for your expertise and wisdom today. And I'm glad we were able to get so many questions in, and thank you to Kathryn for sharing your program on hope. Just a couple slides on what's next for 2019. We, as I said, are very much still focused on making a difference with the G7. So we are in active conversations with leadership, with youth delegates. We are working hard to build around and towards the G7 in August. So stay tuned for that, and we'd love your participation in sign-on letters and advocacy. We are also building up a speakers bureau for our coalition members, knowing that so many of you are out there in the world meeting with youth and perhaps having opportunities to speak. We also get a number of requests that come into the Global Coalition for different speakers on different topics. So we want to start to create that inventory that we can share and be responsive. And we certainly are focused on, bringing all of these voices together and through these virtual forums or webinars. And our tentative next one is on July 2nd. So we'll be inviting you to share your feedback with us in terms of content or topics you'd like to hear about, programs you'd like to see highlighted. So if you're asking yourself what you could be doing now as it relates to the Global Coalition work, if you haven't already joined, I really invite you to. It's simple. You just go to whymentalhealth.org and you can sign up and provide your logo, and we'll send you a welcome kit with social media messages. We'd love for you to participate with us in the coalition effort around the G7 campaigns. There are multiple things happening there, and we'll continue to keep you aware of that information via our email newsletter and other venues as well. Certainly, if you have events or conferences or speaking opportunities where you need support or ideas, I hope you reach out to us. Well, as Kathryn did today, sharing, a member highlight and the particular best practice, we're happy to feature our members regularly. And lastly, and probably the easiest, is to keep connecting with us, continue to participate with us on social media. We're using the hashtag #WhyMentalHealth. We will probably be introducing another hashtag as we gear up to the G7 as well. So we'd love for you to engage with us in that way. If you are not the main person doing social for your organization, we're happy to have you put us in touch with the person who is, so that we can be engaged. So with that, I just want to thank you all so much for connecting with us, for doing the great work that you do every day on behalf of young people. I want to thank our speakers for their expertise and brilliance, and for their continued passion for supporting young people, and to each of you for joining us and taking the time out of your day to learn a little bit and hopefully connect with new names and new information. And we look forward to the opportunity to see you online and connect with you again in July. So thank you very much for participating, and we'll be in touch soon. Take care.